pleasant day to everyone. In this video, we will be showing all about Turner syndrome. What are the types, causes, symptoms, diagnostics, and its treatment. So what is Turner syndrome? Turner syndrome is a condition that only affects females as a result of an X chromosome is missing or partially missing. Let me tell you a brief history of this disease. In the year 1938, Dr. Henry Turner, an endocrinologist from Oklahoma City, noticed that 7 of his patients between the ages 15 to 23 have dwarfism, lacked sexual development, and had a heart disease. He tried to treat them with pituitary extract, but they did not work. It is only in the year 1960s that they were able to successfully identify the chromosomal abnormalities about Turner syndrome. What is the cause of this disease? Turner syndrome occurs when one of the 2 X chromosomes, normally found in women, is missing or incomplete. Although the exact cause of Turner syndrome is not known, it appears to occur as a result of a random error during the formation of either the egg or the sperm. It is deemed to be a numerical chromosomal aberration, the failure of chromosome division, which resulted in a cell with an extra chromosome or a deficiency in chromosome. Now, what are the symptoms when a person has Turner syndrome? Girls are shorter than average. They often have a normal height for the first 3 years of life, but then have a slow growth rate. Another are non-functioning ovaries. Third, in their early childhood, girls have frequent middle ear infection, which can lead to hearing loss in some cases. And lastly, some have problems with math, memory skills, and fine finger movement. Diagnosis. When Turner syndrome is diagnosed prenatally, the diagnosis is usually based on the findings of: first, fetal edema on ultrasonography. Second, abnormal levels of chorionic gonadotropin, conjugated estriol, and alpha fetoprotein on screening of maternal serum. Third, Turner syndrome should be suspected in any newborn girl with edema or hypoplastic left heart, since the frequency of both conditions is increased among children with Turner syndrome. Affected girls receive a diagnosis as a newborn because of puffy hands and feet. Approximately 1/3 of girls with Turner syndrome receive their diagnosis in their mid-childhood on the investigation of short stature. With the exception of familial short stature, Turner syndrome is the most common cause of short stature in otherwise healthy girls. There are 2 types of Turner syndrome, the classical and the mosaic. The classical Turner syndrome, wherein an X chromosome is completely missing. This affects about half the people with Turner syndrome. While mosaic Turner syndrome, wherein the abnormalities occur only in the X chromosome. Treatment. Although there is no known cure for Turner syndrome, some treatments can help minimize its symptoms. This includes human growth hormones. If given in an early childhood, hormone injection can often increase the height of an adult by a few inches. Second, estrogen replacement therapy or ERT. ERT can help start the secondary sexual development that normally begins at puberty. This includes breast development and the development of their hips. Healthcare providers may prescribe a combination of estrogen and progesterone to girls who have not started menstruation by the age 15. ERT also provides protection against bone loss. And lastly, Regular checks and access to a variety of specialists are important for the various health problems that can result from Turner syndrome. This includes ear infection, high blood pressure, and thyroid problems.